Welcome to House Call, brought to you by MedBridge Education. House Call is here to share stories from the home health field. The challenges, the funny or awkward moments, and hopefully some success stories too. We want to share stories from patients and clinicians to help you develop the skills needed to provide a great experience for your patients. We know you want to get your patients feeling healthy and independent, and we want to help you get there. I'm Tanya Miller.
And I'm Amanda Fay. As a physical therapist and nurse, together we have more than 50 years of experience in home care.
Today, we'll be sharing strategies to assess patients' readiness to change, a critical first step in the motivational interviewing process. We'll start by hearing from a patient and their nurse, and then Amanda and I'll provide you with some advice to better engage with that patient. So let's get started by hearing a little bit about our patient. Our patient today is John Lee. John is 82 years old and he lives in Harrisburg, Pennsylvania with his wife, Sally. They've been married for over 60 years and they are still very much in love. John is especially in love with Sally's cooking and baking. When he was diagnosed with diabetes 25 years ago, he started managing his condition with medication and cutting back just a little bit on Sally's homemade sweets. But lately, he's noticed his condition worsening and was hospitalized for a fainting episode. He was sent home, and John was instructed to take more medication and follow a more strict diet, or he would have to start taking insulin. This whole ordeal has been very stressful for him, and he has really been missing the comforts of his favorite foods. Amanda, can you tell us a little bit about John's nurse?
I sure can. Tanya, it started out as a really great day. The sun was shining, the roads were clear, but it got a little iffy when Laura forgot to hang her bag on the door during her third visit of the day. And unfortunately, the patient's cat peed in it. As we know, there's no recovering from that. So Laura threw everything away, and while eating lunch, she had to drive back to the main office and restock. After John's appointment, she has to admit a patient with a complex wound and IV therapy, and as we know, that's at least a 2 to 3 hour visit. So she's got a pretty long day ahead of her.
Wow, Amanda, that sounds like a really challenging day. We know home health and pets, that is a fun combination. And unfortunately, we're about to hear it's going to get to be a challenging visit with John as well. So let's listen to their conversation now, and then let's provide some tips for clinicians like Laura to make the best out of these challenging days.
Hello, Mr. Lee. How are you feeling today?
I'm okay. I'm still really tired from being in the hospital, but so glad to be back home for my wife's cooking. The food in the hospital is awful. It's so bland.
I'm so glad you brought up food. You know, your doctor wanted to make sure you were on a good diet for your diabetes so that your blood sugars stabilize and you can stay out of the hospital. Did you know that diabetes causes damage to your vessels? Every time that your blood sugar is high, it begins to silently damage your kidneys, eyes, and heart. It's good that we're talking about it.
Well, don't get me wrong. I don't want to go back to the hospital, but I don't know why the doc is so hung up on my diet. I've had diabetes for years. I've always eaten good home-cooked meals, and I've been able to keep my sugars in line. I don't know why this has anything to do with my diet.
You know, most patients think that their diet is healthy, and they really don't understand all of the hidden sugars in their food. Here, let me show you this list of healthy foods you should be eating. I bet you're not eating a lot of them.
We can do whatever you want, but I'm telling you, I eat really good, and my wife isn't going to change how she cooks.
Well, let's just look at the list, and then you'll see how many more healthy choices you could be making.
Go ahead. Let me hear what you have to tell me.
Okay, so you can see that carbohydrates here have a lot of sugar, and you are eating quite a number of carbohydrates. That is causing your blood sugars to rise.
Oh, the nurse didn't even give John a chance to talk about if he was ready to change. There may have been a moment when he said, I don't want to go back to the hospital, but then she lost it.
Yeah, she really, unfortunately, missed a lot of great opportunities here to understand where he really was in this whole process. You know, that's why understanding what stage of change patients are in is so important. It is evident from this interaction that John was not ready to make a change.
Yeah, and it's so important to understand, what stage people are in, because often we just jump into, yes, you're in action now, but it's actually, we haven't even explored. Are they in action or are they in pre-contemplation?
Yeah, and that pre-contemplation stage is so important to understand. That's the stage where people do not believe they need to change because they don't believe there's anything wrong. And if we start to educate people like the nurse went ahead and did in this scenario and start to tell them all the reasons, it's just going in one ear and out the other because they don't need to change. There's not a problem. And you could really see that in this scenario. And we oftentimes miss that because we go right into that education mode.
Yeah. And I totally get where the nurse was coming from because we all have those check boxes, to make sure that we get our documentation done, make sure we hit all those key points. But that's again where we bring in mindfulness, right? Because if we're not mindful about where we are and where our patients are, we just cruise right by. So again, my nursing friends, my healthcare professional friends, Tanya and I want you to take a nice deep breath. We want you to give your best. So before going in this time, pause, take a deep breath, and let all those things that you've brought with you fall away, because then you can be in the moment and be with that patient.
And one thing I want to point out, you brought up those check boxes and that documentation. Our documentation systems are great tools. They guide us, they help us not forget things, but they shouldn't run our patient care. We run our patient care.
Right.
And we use that documentation as a great tool to give that information to other clinicians and give that information to who needs to have it. But don't let it run your patient care. You can still document what happened without going through all the check boxes that are sitting there in your documentation.
You just made my heart sing, because when I think about being a clinician, how do we bring our clinicianness into our patient interactions? Using the documentation as a tool and allowing our clinician brain to thrive is one of the most important things. Thank you so much for bringing that up.
Yeah, and it's it's taking that step back that you said with that mindfulness and really realizing where that patient is in that stage of change. So important. So now that we kind of talked through this, let's go to that next scenario and really see how the nurse can apply that great nursing skill and really understand where that patient is in that stage of change, and then how she can impact that to have a positive outcome.
Hello, Mr. Lee. How are you feeling today?
I'm okay. I'm still really tired from being in the hospital, but so glad to be back home from my wife's cooking. The food in the hospital is awful. It's so bland.
Yeah, it can definitely be a little bland. I'm glad you brought up food. That was one of the things I wanted to talk with you about today. Do you mind if I take a seat?
Sure, go ahead.
Thanks. So, I was talking with your doctor, and he wants to make sure you're on a good diet for your diabetes. We want to help stabilize your blood sugars and keep you out of the hospital.
Well, don't get me wrong. I don't want to go back to the hospital, but I don't know why the doc is so hung up on my diet. I've had diabetes for years. I've always eaten good home-cooked food and have been able to keep my sugars in line. I don't think this has anything to do with my diet.
I hear what you're saying. Let's come back to that in a moment. Can we talk about what brought you to the hospital this last time? Could you tell me why you were admitted?
My wife found me wandering outside in the cold.
That sounds scary. What brought you there?
I'm not really sure. I was confused and she couldn't get me back inside. She thought I was going to freeze. The ambulance had to be called.
Your wife must have been very worried about you. At the hospital, did they find out why you were confused?
Yeah. My sugars were above 800.
I see. That is pretty high. So let's go back to your sugars and your diet. Is that all right?
Sure.
I know your wife is quite the cook. What are some of your favorite meals that she makes for you?
Well, we could be here all day. She's an incredible cook. I love her homemade breads and pasta. She makes a delicious lasagna. And she also makes really good pies. But don't worry, I know that sugar in pie is filling and it's too much sugar. So I scoop out most of it and really just eat the pie crust.
Wow, that all sounds delicious. From your description, would it be safe to say that you have a good amount of pasta and bread in your diet?
Yes, that's correct. We have pasta or bread with dinner almost every day.
Did anyone ever talk to you about how breads and pastas become sugars?
No. No one's ever mentioned it. Bread and pasta become sugars?
I know, it's surprising. If it's all right with you, I can explain that to you. And then maybe we can think about how your current diet might turn into a bit more sugar than you thought.
Sure, that sounds good.
Yeah, I know it sounds strange, but when foods like bread, pasta, and even pie crust break down in the body, they become simple sugars. To your body, when you feed it bread and pasta, it's just like eating a handful of candy.
Oh, I didn't even know that. And that could cause my blood sugar to go up. Maybe I do eat too much sugar then.
Yes, that's right. It's surprising, but it can make a big impact on your blood sugar. Tell you what, why don't you think about what we talked about until I come back again, and maybe we could have another discussion about your diet and your health.
Would I have to change a lot? How will I know what foods become candy sugars?
Don't worry too much for now. We can talk about that more when I come back. As for the change, we don't have to make a lot of changes to start. We can move slowly. Every little change we make can make a difference. It's good to remember that.
I'll definitely think more about it. I don't know why no one has ever talked to me about this stuff before. I always just got lists of foods that I should eat, but it's just a bunch of stuff that I don't like or I don't know how to make. Since my sugar was managed, I didn't even think about my diet. I just threw that stuff away. I don't want to go back to the hospital and scare my wife again.
That makes sense. I certainly don't want you to go back to the hospital either. I've given you a lot to think about, but we'll take it one step at a time together.
Did you hear the way the nurse navigated that conversation? That was so much better than what we heard the first time.
Absolutely, Amanda. There was a time where that nurse could have taken the easy route. When the patient was just kind of angry and dismissive, they could have just ended it there. But she hung in there. She dug deep and she asked those open-ended questions and really got to the root of why the patient didn't want to change or didn't know that they should change.
I know, it was great to hear that. And by doing that, she was able to really understand his motivation. And I think he's much more ready to make that change now.
Absolutely. So for our clinicians listening out there, as we're seeing the patients throughout the day, remember what we saw in this scenario. First, start by identifying the stage of change. It's important to understand what stage of change your patient's in before jumping right into education and planning. When you identify the stage of change, make sure you use the appropriate strategies. There are unique strategies to support patients in that pre-contemplation stage. This means that this person doesn't believe there is a need for a change. If they're in the contemplation stage, they might be thinking that maybe they need to change, but they're still not there yet. And you'll have the greatest impact if you use the right strategy for the right stage. By employing these strategies, you support patients in their plan to move forward with their health behavior changes. And this makes your interventions more efficient and effective. So that's a wrap for today. And thanks for listening to House Call.
And thanks for providing great care to your patients. We'll see you next time.
House Call was brought to you by MedBridge Education. If you'd like to see if you can earn continued professional development credit for listening to this episode, log into your MedBridge account and navigate to the course where you'll find accreditation details. If applicable, complete the post-course assessment and survey to be eligible for credit. To hear more episodes, search for House Call in the MedBridge course catalog. Thanks again for listening.